What's up, y'all? This is Not a Real Doc DPT, and no, I'm not a real doctor, but I am a doctor of physical therapy that's been licensed and practicing for about 12 years or so. And today we're going to be talking about the topic of that, well, can be a little controversial at times. I don't really think it is, but some people might, and that is what is physical therapy compared to chiropractic care. So, physical therapy care, this is going to be uh, care where we are trying to put your body in the best position to heal itself ultimately. We do this through a couple of different means. One is going to be doing different types of manual therapy. We may be doing spinal manipulations. Manipulations are when you kind of crack your bones like I just cracked my knuckles. So those are just all manipulations of the knuckles. Well, we may crack your neck. We may manipulate your neck. We may manipulate your spine to alleviate pain, to free up how that joint is moving, so that then we can work it, we can stabilize it, we can uh, work on strengthening those muscles to ultimately help decrease pain or dysfunction that you might be having in your spine. We also might be doing manual therapy involving dry needling, where we're actually putting needles that are not delivering any sort of medicine or liquid through them, so that's hence they're dry. So dry needling into a particular area to relieve a basically a muscle spasm, looking at delivering that to an area where nerves are maybe very taut. So we're trying to basically calm things down by palpating those structures internally or around those structures internally to help alleviate pain and dysfunction there. We may be doing myofascial work with our hands or with instrument assisted tools where we're actually going over the muscle belly and trying to go in the direction of the muscle, breaking up any scar tissue that may have developed in a particular area due to inflammation in that area. We may be delivering physical therapy care via different modalities like traction. We may be using TENS units. We may be using ice, heat. All of those have their place in delivering physical therapy care and helping to decrease your pain. Also, the final kind of piece of the puzzle that we might be working with you is utilizing exercise. And within that toolbox, we will be pulling out exercises that are specific to the joint, the muscles that are causing the pain and dysfunction, and trying to uh, help basically grow you out of the pain that you're having by working those different areas in a therapeutic range. So it's in that exercise component where you start to see the differences between physical therapy care and chiropractic care. So chiropractic care, we they may do some of the same things that we do, such as manipulations. That's really probably the thing that they're most known for is working on the spine and helping by manipulating joints. They may do that with their hands. They may do that. I think they have some like little trigger gun that they use. They may have a machine do it, but there are different ways that they utilize or that they different ways that they go about performing a similar manipulation that you might receive in physical therapy care. But oftentimes with chiropractic, that's where the care is going to stop. Depending on the chiropractor that you're going to, you may be getting maybe a sheet of paper that has some exercises on it, and then saying, okay, hey, do these, um, and then come back to me next month. But oftentimes, and chiropractic care is going to be characterized by things that are being done to you, and that's where oftentimes that care will stop. So that's where you're starting to look at the main differences between chiropractic care and physical therapy care. We have several areas where we're going to overlap and are doing similar things, but then we're going to diverge in the mindset, I would say, and the plan of care that we follow to continue to progress you. So we're going to start not just doing passive things to you, okay, but then by adding in those active things that you are going to do. So then that way, as we continue to work with you over time, continue doing those passive things to you via manual therapy and modalities, and then you continue doing the exercises and things on your end, then over time, you grow that area out. As I mentioned before, you kind of grow out of that situation. And then that's when you get improved range of motion, decrease pain, and then significant improvement to function. So, our intent in physical therapy is for you. I kind of joke about this, but we are in physical therapy, we're the folks who are constantly trying to work ourselves out of a job. Our intent is for you not to stay a forever patient, but for us to work with you, heal you up, get you going in that right direction, showing you what you need to be doing yourself, and then discharge you, and then you continue doing that. And if come back if you need, but hopefully, Lord willing, you don't need us, and that's all great. That's what we're looking to do. Chiropractic care takes a different approach. They oftentimes are looking for you to, well, let's just say they follow more of a membership type of model. It's kind of like joining a gym. So anytime that you're having pain or dysfunction, then in your spine, you sign up, you get like a monthly membership, and then you can go to see the chiropractor X amount of times, and he can make you feel better, which he can. Those manipulations that are being performed, as I say, those are very similar to what physical therapists are doing as well, and so that can help. It can. Studies have shown that anytime that you are having that manipulation done, when you develop that pop, there is an analgesic effect there that is associated with decreased pain and improved mobility into the area. But the difference with chiropractic care is everything that the chiropractors are going to do. Well, typically, let me say that everything that the chiropractor is going to do with you is going to be done to you, not by you. So chiropractors have more, as I say, the membership model mindset, where you're going to continue to come back to them over and over again, throughout a year or however long your membership is, and they will continue doing those adjustments. And so it makes you more reliant on them to help you to control your pain and your dysfunction. Um, so so that's the main difference. If you're looking between differences between physical therapy care and chiropractic care, that's not to say that chiropractic care is bad. That's not to say that you should not be doing chiropractic care. There are some chiropractors in my area where I practice that are good chiropractors. I hear good things about them, and they seem to be doing, a great job. So I'm not opposed to chiropractic care, as long as you understand as a patient what it is that you're there for. And they don't really follow so much a healthcare model as I say a membership model. So if you are willing to pay for that, and that is, that meets your goals, and that's what you are happy with, well, hey, more power to you. Seek out that chiropractic care, and they can be beneficial. Let me come back. uh, this is where the controversy, I think, with chiropractors may sometimes come in. I'll tell you this from a personal experience. I had a physical therapist that I used to work with who had a mild form of Tourette's, and it wasn't extremely noticeable, but you would notice that every once in a while, like he's like clearing his throat, and so this is a Tourette's thing that he had. Well, he was a physical therapist, has been one for many years, and he was at, I can't remember exactly whether he was at a convention or what, but he came across this chiropractor who started talking to him about his Tourette's and talking about how chiropractic care could cure his Tourette's. Okay. uh, no, that's there's no, there's not a reputable study that you're going to be able to show me that shows that chiropractic care is going to cure your Tourette's. Can it make it better if you feel better. So then therefore you have less anxiety. And if you have less anxiety, then therefore you have less Tourette's. Maybe, but that's not curing the situation. He explicitly said that he was told, because this chiropractor did not know that he was a physical therapist, and um, he said he was specifically told that his Tourette's would be cured, and that is that's borderline malpractice, if not outright malpractice. There is not a reputable study that I am aware of that would relate that. I couldn't even tell you the mechanics behind that. As I say, the only chance that I can think of to even be able to make that claim would be more in the anxiety and pain relief type of phase, and then maybe that would trigger the Tourette's a little bit less. But as I say, that's not a direct one-to-one type of thing. So as long as a chiropractor is staying in their lane and are practicing in the musculoskeletal, well, not muscular so much, but in the skeletal arena, which is what they're trained in. As long as they're popping your joints, hey, they can be very beneficial. If you get into the kind, though, that are kind of trying to use chiropractic care for things not related to chiropractic care, such as Tourette's, then you should be careful of that type of a person. Same thing with physical therapy. If a physical therapist was to come and say, "Hey, if I dry needle your neck, we'll cure your Tourette's," no, that's not going to happen. There's no mechanism there that you're treating that could do that. So you would want to stay away from that person as well. So I I wanted to do a video and put that out there just because oftentimes you get questions about, well, how are you guys in physical therapy different than the chiropractors that I'm seeing? And I will say this also, chiropractors and PTs, like I don't, sometimes there's sometimes it seems as if our disciplines may be kind of fighting each other a little bit and stuff. I don't see that at all. As a matter of fact, around here, I actually have had a physical, I'm sorry, I have had a chiropractor who would refer me patients as well. So I think chiropractors are folks that we can work with. As I say, as long as they kind of stay in that lane where they're trained in, they can be very good. They can be very beneficial to you. It's just when you start to get off into the stuff that's not quite so great, and those that are straying away from that kind of skeletal arena, that I would be kind of cautious of. But the same would go for a physical therapist, as I mentioned. So I hope that clears up for you any questions you may have had between what is physical therapy and what is chiropractic. If you have any questions about that, please put some comments to this video. If this video is helpful for you, give us a thumbs up, and we'll catch y'all later. Bye.